Mark, there's two MVAs coming, both in the same vehicle. One's agitated and doesn't want to be here.
Trauma 1, Trauma 2?
Yep, Trauma 1, Trauma 2.
The Director of Emergency, Dr. Mark Putland, is getting details about a high-speed car crash involving 2 victims about to arrive under police guard.
5 police is a lot of police.
Road accidents are the single biggest cause of major traumas at the Royal Melbourne Hospital.
Police and ambulance are coming with some motor vehicle accident victims. No seatbelts, not being very cooperative, hence police helping out.
It does start to paint a certain picture. We're always on our guard a little bit. We're a little bit more cautious, but we try to take a fresh start with each person.
The driver of the car arrives first and is rushed into Trauma 1 in a critical condition.
Do not lift your head up. Do not.
He's been in a high-speed MVA. The area that really is complaining of pain is in the right side of his neck and his lower abdomen.
The team needs to move quickly to find any potentially fatal internal injuries and bleeding.
I'm going to have a little look at your tummy with the ultrasound, all right? At the speed that you can to a stop, things can kind of tear.
His blood pressure's low, his heart rate's high. We find evidence of bleeding in his abdomen.
Dr. Mark's also on alert for the second victim, who is the passenger in the car that crashed head-on into a stationary truck. He's highly agitated and the situation is potentially volatile.
It could be a head injury and 90 kilometres an hour head-on to another car and being a bit uncooperative. Anything's possible. Helps that he's coming with police. If they come in and they've got him under control, then it takes that pressure off us a little bit. Come on in.
The man has been disruptive and uncooperative with the paramedics and acting very strangely.
Yeah, g'day, mate.
Bed right there. Get on there.
Just wriggle over here.
Thank you, mate.
Good chap, good chap. Nearly there, nearly there. Oh, that's the way. Okay, okay. Wrong side up. Right over the other side. Hey, good man. All right, geez, you've had a rough day. All right.
Yeah, you can say that, mate.
My name's Mark, I'm one of the doctors.
Nice to meet you, mate.
What has happened to you today?
Man, I was just off for a cruise and then something seemed to go wrong.
Something seemed to go wrong. Oh, don't wriggle around too much because you're in the Royal Melbourne Hospital.
Why?
Because you had a crash.
Did I really?
Is the rear passenger unrestrained of a sedan hitting a truck? Left shoulder pain.
Just leave your head back. Leave your head back.
He's quite uncooperative and is almost on the nod as if he's affected by heroin or another drug. He has denied any alcohol or drug intoxication. I was unable to get him to comply with a collar or any other spinal precautions.
It's not aggro with you, just wriggly.
Correct. Uncooperative is a good word. There was no aggression.
Yeah, touch my head like that, please.
If I need to put a collar on you, is that okay?
No, I don't want to call it. I'm not a dog.
The team must take the man's clothes off to examine him properly, but he seems reluctant.
You got a right to be a goose in a way, like if people are allowed to be stupid, but if the reason they're being a goose is because they're really, really sick, or if it's just they're a goose. So it's a delicate balance. Just, hey, lie down, go back to sleep.
For some unknown reason, the man continues to resist having his clothes removed, behaviour that's making Mark suspicious.
Keep your head still. You're covered.
Royal Melbourne receiving.
Trauma call? Yeah.
Carolyn, this guy that's coming in with the chopper.
It's the start of shift for Dr. Miriam Yasser, who's been at the Royal Melbourne for 2 years.
He's stable, open to fib fracture, but his heart rate's 50. The thing that I love most about my job is the interaction that I get to have with patients. You're in a uniquely privileged position where patients are at their most vulnerable, and I think that's incredible.
So do we know if the chopper's coming into here or the
80-year-old is coming here.
The 80-year-old? Yeah. Car, bike?
Bike.
Dr. Miriam and nurse Maddie White are standing by for an incoming trauma. An air ambulance is arriving from rural Victoria with another motor vehicle accident. This time, it's a motorbike crash.
We see motorbike trauma quite frequently, and the ones that I have seen have been associated with quite a significant injury.
The 82-year-old man was thrown into the air and slid 6 metres into an embankment. He has multiple fractures and a dangerous case of nausea.
That first hour in hospital is so critical. You know, we call it the golden hour, and it's the make or break period of that trauma.
Can you give us a hand? He's just going to be sick. Just Caitlin, Rex. Yeah. Just hold it for a tick.
We're just going to roll you to one side.
Can we get some Gepperidol, please, Maddie?
Gepperidol?
Yeah. The nausea and vomiting presents a time delay in how quickly we can get Rex to the scanner to assess if he does have any other injuries. Because he's lying flat in a collar and he's vomiting, it does pose a risk that he might choke on his vomit.
Ready, set, go. Rex was out on a group motorbike ride today, so he's riding a high-powered motorbike, full face helmet. He's hit some gravel with his rear wheel and it's then eye-sighted, so it's skid out and it sort of flicked him up into the air.
Do you know how fast he was going?
So we're not really sure. It's up to an 80k zone, so we'll say max 80k's.
Okay, and have we managed to contact any next of kin at all?
He lives with his wife.
Hi, Rex. Hi. How are you going? My name's Miriam. I'm one of the emergency doctors. I'm going to be taking care of you while you're here.
Good.
How long have you been riding for?
All your life.
All your life?
Straight away, Dr. Miriam organises an X-ray.
We're ready for an X-ray.
All right, anyone without lead, can you please leave the room? Fractures for elderly people have different implications than they do for young people. Their bones are often a little bit thinner. They take longer to heal, and that also has implications for their recovery and rehab. Okay, so we have tib-fib fractures.
Both bones in Rex's lower leg are badly broken and he'll need urgent surgery.
You've broken your leg, my darling. Your left lower leg.
Is a little bit sore.
It's a bit sore. It's broken, so that's why it's sore. Yeah, okay. Have you ever had any accidents before this one? Have you?
14 broken bones.
14 broken bones. Well, you've added 2 more today. Yeah. The fact that Rex has broken multiple bones before this presentation doesn't really surprise me at all. The fact that he's made it to 82 with all of his injuries is a pretty great thing. I mean, it's amazing.
Because Rex crashed at high speed and was thrown into the air, Dr. Miriam wants a scan of his head and neck, looking for brain and spinal injuries. On the way, Rex takes a sudden turn for the worse.
Hey,
I feel like I might bring something up.
you gonna vomit? If you vomit laying down, you're going to swallow it and it's going into your lungs and then you'll stop breathing.
20 minutes. Okay, thanks so much for the call. Bye.
At the Royal Melbourne Hospital's emergency department, Dr. Maya Cubitt's just taken a call about yet another road accident.
Emma, it's Maya.
Hello, how are you?
The spate of car crashes means Dr. Maya is juggling multiple patients. So she's handing this case to colleague Dr. Emma West, who's just down the corridor.
There's a trauma coming in. It's a young woman who drove into a rock wall at about 5:30 this morning.
Hold on 2 secs.
Oh, there you are. Self-presented to Seymour Hospital with tachycardia, pain throughout her spine, her pelvis, altered sensation in her right leg.
Yep.
A young car crash victim with a disturbingly high heart rate is being transported by ambulance.
Trauma call's gone out?
Yes.
Yeah, good. I'll speak to...
And there's a MET pack coming.
Lovely. One of the things we're worried about is she's got a really fast heart rate of between 130 and 150. And we know that's a marker of a potentially severe trauma. So we're activating our trauma call criteria, which means we get surgeons, anaesthetists and nurses, a group of people together to work on the patient when they arrive.
Dr. Emma has assembled her team, but the rural ambulance is still en route.
I get really impatient and antsy when they're not here. But no one's here yet. Potentially this young woman has become more unwell on the way to hospital. Her heart rate's really fast and the types of injuries that come to mind include hidden bleeding. That's what we're really worried about and that can be life-threatening.
It's just calling about the trauma we're expecting. There's nothing popped up on the board, and the ETA was 15 minutes ago.
How's that pain now? Are you still in pain?
Back at the CT scanner, 82-year-old biker Rex is in a bad way. He was in a high-speed crash, fracturing his leg and causing a life-threatening case of nausea.
Feel a bit better now?
Horrible.
Yeah? I'll get you a little spot.
Dr. Miriam is concerned about the continual vomiting.
What pain relief have we given him here? He seems to have vomited after fentanyl with the ambulance and then after
time
fentanyl.
it was on movement.
It
so
was
it was
on
like
movement,
when we
okay.
went to scan and when we went
So
to...
while Rex has his scan, Miriam investigates which pain relief to use while treating his fractured leg. The wrong choice could make the vomiting even worse. It's a critical decision, so Miriam gets advice from the physician in charge today, Dr. Michelle Thornhill.
The issue with him is that he's been quite nauseous. He's had a few vomits, mainly just on movement.
Maybe we could just try some dissociative ketamine.
Ketamine would have the least impact on things, including his blood pressure. We use it quite frequently to help sedate people, and it does provide a bit of pain relief as well.
All right, Rex, I'd like you now. Just think of somewhere nice you'd like to be. Nice holiday spot.
All right, Rex, we're just going to lift up your leg, darling.
Good job, Rex. Just some nice, slow, deep breaths.
With Rex now sedated, Dr. Miriam splints the badly broken leg to keep it straight and prevent movement.
Just gonna give you a little bit more, Rex. Doing really well. All done. Did well. Keep taking those deep breaths.
Earlier today, Rex had been enjoying a motorbike ride with a group of friends. And now he's in hospital facing emergency surgery.
I hate motorbikes. My husband rides a motorbike and he's now sold that, which is great. And my dad had a really bad motorbike accident when he was 22. So I hate them. They ruin lives.
Yeah, sure. So just stand back.
Rex, how you feeling, darling? You okay?
People can sometimes react quite badly when they're coming out of their ketamine sedation, and that usually presents as them panicking or becoming a bit frightened.
Rex, I know it's horrible. You're okay. You're safe. You're safe, mate. You've just had a bit of ketamine that makes things feel a bit weird. Rex, it's Maddie, the nurse. I'm there to reassure him, make sure that he doesn't feel alone in this really, really awful day. You feel funny? Yeah? I might get your wife in. Would that be nice?
Rex's wife Robin and daughter Belinda are waiting anxiously outside the trauma bay, but they haven't been able to speak to him yet.
We're still waiting for some scan results. So we ended up scanning from his head down to his ankle, just to make sure everything's okay. Waiting for those formal results to come back in the next hour to two. And then from there, we'll have an idea of how bad things are and if he's got other injuries, okay?
Rex and Robin have been married for 57 years.
I was trying to act as though everything would be fine, be confident, but then I also had to think that if he rides motorbikes, he's in an accident, there is a chance it could kill him.
You can come up, darling. Come up and hold his hand.
But at 82, to die doing what you love doing is better than, not going out there and doing what you love.
Keep your head still, happy.
Hey, lie down, lie down.
Down the corridor, Dr. Mark Putland has a double trauma on his hands, with 2 victims being treated in separate rooms after a high-speed car crash into a stationary truck. In Trauma Bay 1, the driver is in a critical condition with massive internal bleeding. Next door in Trauma 2, his mate and passenger in the car is behaving strangely. and Dr. Mark's trying to understand why.
Hey, what have you had this morning? You don't look like your normal self.
You don't know me.
What drugs have you had?
So for my patient, it doesn't seem like he's bleeding. His mental state has been peculiar and is now becoming sedated. Our concern really is to rule out a serious head injury.
What have you had? You did grog or something else?
So that you don't...
Move your neck around because you don't know if you've broken. Okay, I'm just going to take a quick ultrasound of your belly.
Try and uncover every part of him, make sure he's okay.
You're covered.
Yeah, we'll keep your blanket over your cods, okay?
With the patient continuing to resist having his jeans and underwear removed, Dr. Mark's suspicions grow.
You got anything valuable in your jeans pocket?
I got a saw.
Okay.
So he decides to check inside the man's underwear to find the cause.
Oh, look at that. Look at that.
Just pulled his jocks down to have a look, make sure there wasn't a big bleeding or bruising around his scrotum that can go with a pelvic fracture. As I'm uncovering him, I've found something in his underwear that starts to make sense of his behaviour.
No wonder he was worried about taking his jeans off.
Dr. Mark has found suspected illegal drugs in the man's underpants.
Okay. So don't wash your hands with that hand gel because I suspect it's I suspect it's not. Well, hand gel's often not hand gel when it's kept in the underpants of people who also store bags of white powder in their underpants. Probably explains why he's a bit peculiar today.
Next door in Trauma 1, the other victim involved in the high-speed car crash is seriously injured.
Do you still feel like you're going to be sick?
A little bit, yeah.
An ultrasound has found more than a litre of blood in the driver's abdomen from a torn bowel. As he's prepared for urgent surgery, the police get to work gathering evidence on his mate next door.
His undies. No track marks anywhere.
That's all right.
That's all right.
Mate, have you got any needles on you? No. Have you got any needles on you? No. Okay, all right. We just want to make sure everyone's safe.
In this type of case, the hospital is required to provide police with the patient's blood results after a motor vehicle crash.
So we've got this tricky balance. I don't want people afraid to come to hospital. Everyone should be able to come and get taken care of.
Where are you going? To theatre? Yeah.
As the driver is taken for emergency surgery to repair his torn bowel, the passenger is taken to the CT scanner to check for any internal injuries.
Please breathe in and hold your breath.
He's escaped the car accident relatively unscathed.
It's remarkable what people are able to get away with sometimes. This was, by the sounds of it, a pretty decent speed and a decent impact, and they've managed to get away with it, which is dumb luck, I suppose.
We've got a huge team ready, so we're just trying to figure out where they are. Hopefully they're here soon.
Dr. Emma West and her team are still waiting anxiously for their young car crash victim, who was due 15 minutes ago. Paramedics can only predict how long it's going to take them to get to hospital.
We are expecting a young woman to arrive from a rural location whose heart rate's really fast. And with that, we're really worried about internal bleeding or a significant injury from the car accident. And we've got news that they've just arrived.
In this case, the patient needed to be transferred en route to a mobile intensive care ambulance with life-saving specialist equipment on board.
As the patient comes in, our priority is to really figure out how that patient is going right now.
1, 2, 3.
Nurse Julia Hoyles is on hand to help treat Laura.
Sorry, darling. We're just going to listen to why you're here, okay?
This is Laura, 23-year-old female. So Laura was the rear passenger. The driver's lost control, striking the front left-hand side. Laura was wearing a seatbelt. Obs-wise, she's sustained a tachycardia at 130 to 150.
A normal resting heart rate is below 100. Laura's rate has been around 150 for many hours, putting serious strain on her heart.
She's got this really fast heart rate and we don't know why. We still don't know if she's got an injury yet.
You guys can go down to recess 3, all the way down past the traffic.
Over in triage, nurse Yasna Cardoza is working her way through a long queue of patients.
Next waiting, thanks. I love being at triage. You see every single patient that walks in through that door and you're the one that has to decide in that split second where they're actually going to go. We're flooded. Communication is a big key when it's like this. You're welcome, you're welcome. Last week I was at triage in an 8-hour shift, on a morning shift. I triaged, I think it was like 110 people in an 8-hour shift. All up for that day, we saw 240 people. Next waiting, thanks. Hi, how are you?
I think I cut half my thumb off doing the dishes.
Nurse Yasna's not only assessing patients through the triage window, she's treating them too.
We'll take this off and I'll have a look. I've got 3 minutes approximately to triage a patient. I need to assess them at the desk in order to figure out where I'm going to allocate them. Just don't want to hurt you. Before you, we won't rip it off, don't rip it off.
The towel is stuck to the wound and Nurse Yasna carefully prizes it away. IT manager Klaus was just doing the dishes when an accident happened.
Now, just flip your thumb over, yeah. I'm going to put a wet dressing on there so then you don't have to rip it off later. So we take the bandage down and I've watered it with saline just to see what we're dealing with, and it's deep. Okay, ready? This is going to hurt because I've got to put pressure on it, okay? Sorry, sir. How did you do it?
Trying to clean the coffee plunger.
Oh. So what actually cut you?
Coffee plunger.
The actual coffee plunger?
As Yasna redresses Klaus's thumb, he goes pale and very quiet.
Feeling busy right now.
Yeah. Did you want to have a sit down?
Yeah.
Yeah, I'll come with you. All right, you hold that. Yeah, let's sit you down. This could end in 2 ways. He'll either just drop and hit his head, or I've got to catch him. How are you feeling?
Dizzy.
Just dizzy? Is it from the blunt?
I don't know.
Do you feel like you need to lay down?
I feel like I need to vomit.
Yeah. I'll get you to lean against this wall for me, if that's okay. I'm going to get you a vomit bag. Perfect. It just goes to show how things can change so rapidly. So 1 minute they're okay, and then the next they think they're going to faint.
Yeah.
Yeah. Do you think you want to lay down?
Helps.
Yeah. Do you think you'd be able to walk to that door and we can lay you down on the bed? So Klaus is pale and sweaty, but you can see his colour slowly coming back. So I need to make sure he's able to get up and get him to a more secure and safe environment.
Yasna moves Klaus to one of the treatment bays.
Are you feeling better laying down now? All right, let me just wrap this up for you. Okay, I need you to take deep breaths for me. So I know it's really sore. Sorry. Sorry. It's just really important for us to put the pressure on so we can stop the bleeding, okay? We'll definitely get you some painkillers. Let me just wipe you down. As you can see, we triage, answer phone calls, and do treatment, as well as coordinate who goes in, who comes out.
Hello, I'm Thomas. I'm another one of the emergency doctors. How did you do it?
Coffee plunger.
Okay, pop it there and we'll have a look.
Dr. Tom Rasgar examines Klaus's thumb to see how deep the cut is.
Yeah, you're down to bone there. Now, it's clearly more than just a superficial wound, and the nerves and tendons have potentially been damaged. Kitchen accidents are not uncommon, broken glasses, broken plates, utensils. They're all reasonably common causes for hand and finger injuries. So we'll pop some local anaesthetic in, try and make it all go numb, and then we'll get the plastic surgeon involved. Can you bend the thumb or not?
I haven't tried, I don't want to.
Have a try.
No, I can't.
OK. And can you feel me touching the tip?
A little bit.
Doesn't feel normal?
No, it doesn't feel normal.
No, OK. So you've got some nerve damage there as well. All right, so I'm going to pop some local anaesthetic in. In the long term, it might not be like it was yesterday. So he might have some nerve damage. He might have some difficulties with a full range of motion. We'll know a little bit more once his local anaesthetic's worked and we can have a better look at what's working and what's not.
Klaus has sliced through nerves and tendons, and without surgery, might lose the use of his right thumb.
So this is the part that stings. Sorry.
Rex? You got to keep your head still, darling. Keep your head nice and still. It's okay.
Dr. Miriam has splintered 82-year-old biker Rex's broken leg in preparation for emergency surgery after a serious crash.
Come on, come on. It's okay, it's all right.
You're all right. You're all right now. You're in good hands.
Rex's wife Robin and daughter Belinda are trying to comfort him, but are struggling to hide their emotions.
Are you okay?
He's usually the strong one of the family. You're on your ride with your mates, on your bike, and you're going around a corner and the bike slid out from underneath you, and then you slid on your butt following it.
Robin has nursed Rex through many motorbike accidents during their 57-year marriage.
He loves it. He loves it so much that, you know, you couldn't take it away from him. But he's just said that this might be his last bike, which I think I'll be very grateful for.
Dr. Miriam finally has the scan results.
How you going, Robin?
Okay.
And the news is not good.
In the middle of his back, there's a fracture in one of the bones. So we're getting our orthopaedic surgeons to have a look at that to see how that will be managed. I don't know if it will need an operation or not at this point.
Okay.
The options to manage the fracture in his spine may include surgical management, which is obviously very risky.
Because of Rex's age, the surgery to repair his broken back is high risk.
Rex, did you hear any of that?
Some.
Some of it?
Yeah.
So one of the bones in your back is broken?
Yeah.
Yeah. The orthopaedic surgeons, the bone doctors who are looking after your leg, they will also look after your spine as well.
Right.
So we just need to wait for them to come in and see you again and decide what to do.
Okay.
Do you have any questions?
When are you going to take this off my neck?
Right now. How's that?
He's a fighter and he takes everything in his stride. The man of the house, just there, you know he's there, 100%. Would have been hard to lose him at this stage.
IT manager Klaus came into emergency after cutting his thumb so deeply, Dr. Tom Rasgar could see bone.
How did you do it?
Coffee blanca.
It's now being x-rayed to check if the bone itself is damaged.
I know that I need to have plastic surgery, and then I will hopefully manage to stitch it back together. Glue it back together, I don't know.
Just come and grab a seat for me.
Yeah.
Not having a functional thumb would be very debilitating, so it needs a proper clean-up in theatre to give him the best chance of recovery as possible.
Dr. Tom is hoping Klaus can go to theatre soon, so Nurse Matthew Biles prepares him for the operation.
It'll definitely be stitches. They'll stitch up. Sometimes, depending on how deep it is, if there's anything inside that needs to be brought together, they may use a dissolvable stitch.
While Klaus waits to be transferred to a ward, his young family arrives to lift his spirits.
Look at the Band-Aid.
It's not a Band-Aid.
It is.
Would you want to really bad that I can take you seriously? Yeah. Anyway, I've got your pyjamas.
Change of t-shirt. I'll put some beer in the fridge.
I can't bring in good news. It sounds like they're fairly keen to do a procedure tonight.
Yeah.
So one of our orderlies will come and take you upstairs. Go up.
Okay.
Okay. Sound good?
Sounds good, yeah.
I'll be back shortly.
Klaus is hoping surgery will mean he'll still have full use of his thumb.
One, two, three.
Back in trauma, Dr. Emma West's car crash victim, Laura, is still in a life-threatening condition. She has a worryingly fast heart rate that could be due to internal bleeding.
When someone has a fast heart rate, we want to know whether or not they've got a broken pelvis, because that's probably one of the worst injuries we see, where people bleed internally from a pelvic fracture.
Your parents think you're all okay.
You can come in.
Laura's emotional parents have made the long journey from country Victoria to be with their daughter.
You okay?
It's very frightening as a parent. It's hard seeing your baby laying there like that.
So I think to sort out the tachycardia, we just need to do a scan and exclude bleeding.
There's little time for a proper family reunion. Dr. Emma is sending Laura for a CT scan to check for potentially lethal internal injuries.
Have you had a CT scan before?
Yeah. One of the things that's puzzled us is her heart rate is really, really fast, and that's sometimes a marker of internal bleeding. Oh, okay. And so we're a bit worried about that.
Yeah. She's got Graves' disease. The heart just goes 100 miles an hour.
Sometimes she said, Mum, feel my heart, and it's just going
fast. Okay.
It's the missing piece of the puzzle for Dr. Emma. Now she has to work out if Laura's fast heart rate is due to internal bleeding or her thyroid condition.
When she got this condition...
The Graves? Yeah.
She was so thin, and
Yeah.
all her hair was falling out. And,
Okay.
And yeah.
So this has been a big stumbling block in her life.
It has, yeah.
So Laura's mum and dad have told me that she has Graves' disease, which is a disease of the thyroid where it's overactive. I really need to think hard about what the cause of her fast heart rate is. The number one cause would be bleeding, particularly in a car accident. But I'm also aware that there are other causes, one of them being Graves' disease.
It can be a little bit of a bump on the way over, okay? Just stay nice and still. Okay, 1, 2, 3.
Dr. Emma heads to the CT scan, where another serious complication to Laura's treatment is developing.
Are we allowed to give iodine? Could she be thyrotoxic?
She could be. In the CT scan, so that we can see an injury, we need to inject iodine dye into Laura. And the problem with iodine is it feeds the thyroid, and this could potentially make her thyroid disease worse. But really, if I don't find the bleeding, then I'm not serving her well in terms of trauma care.
So, priorities-wise, she's tachycardia from a trauma.
Dr. Emma decides to call a specialist to discuss the risks of the iodine dye.
It's Emma West speaking in emergency. Look, I'm seeing a young trauma who has in the recent past been diagnosed with Graves' disease. So we do need to know now-ish if she's bleeding, yes.
Worst case scenario is for a patient to have thyroid storm, and in those cases the heart rate can become out of control and the patient can essentially have a heart attack and die.
Thanks a lot. See ya, bye. Yes, go ahead.
The endocrinologist agree with me. They think the benefit of knowing that she's not bleeding far outweighs the risk of the potential worsening of her thyroid disease.
Okay, Laura, that hot injection's coming now. Just try and follow those breathing instructions. You're doing really well.
Please breathe in and hold your breath.
After a tense wait, Laura's thyroid doesn't react to the iodine dye, so she's safe from an imminent heart attack. Dr. Emma and the emergency team are also able to rule out internal bleeding as the cause of Laura's rapid heart rate.
So it's great news for Laura that she doesn't have any internal bleeding, and actually we can't find anything that's concerning from a traumatic injury perspective, which allows us to move to focusing on her thyroid as a cause of her fast heart rate.
Dr. Emma can now share the good news with Laura's parents, Sharon and Greg.
So I've already spoken to the endocrinology doctor. Yep. They are going to come and see your daughter.
Oh,
and
okay.
we'll get a watertight plan for you.
Yeah. We'd just be happy with her to see
someone regularly.
Yeah. Regularly.
So they'll be back in the next sort of 15 minutes.
Yeah.
Dr. Emma is concerned Laura's Graves' disease is not able to be well managed in her small country hometown. She arranges for Laura to receive care from a specialist endocrinologist.
Nice and bumpy for you? Yeah.
I'm also from a small country town, and when I was growing up, I remember we had a lot of problems getting medical care in our small town. I just really want to ensure everything goes right for Laura, and hopefully she can get her life back on track.
How are you? How are you feeling? Your heart rate's still pretty fast, isn't it? So I've just had a look through your scans. I can't see any bleeding. That's good, yeah. And your brain scan looks normal as well. I think we've got an opportunity to make a difference. While she's here, we'll try and be a one-stop shop for her and get the follow-up she needs.
So she can start the anti-thyroid drugs when she's in the ward under the trauma team. The thyroid specialists will figure out how much she needs, what type she needs, and what ongoing care she might need.
There's 2 MVAs coming.
Yep.
One's agitated and doesn't want to be here.
Trauma 1, Trauma 2?
Yep, Trauma 1, Trauma 2.
Come on in.
Dr. Mark's double trauma patients had very different outcomes from their head-on car crash.
At the speed that you came to a stop, things can kind of tear.
The driver underwent emergency surgery to have some of his bowel removed and almost 2 litres of blood extracted from his abdomen. He spent 10 days in hospital.
He's quite uncooperative if he's affected by heroin.
Oh, look at that. Look at that.
The passenger was kept for observation, but discharged himself a few hours later. The substances recovered from his underpants were taken by police.
Yeah, you're down to bone there.
IT manager Klaus had his thumb stitched back together.
Look at the Band-Aid.
It's not a Band-Aid.
And he's recovering well. 82-year-old biker Rex was flown to hospital with a badly broken leg and a broken back after coming off his motorbike at high speed. Rex's first memory after the accident was waking up in hospital and seeing wife Robin by his bedside.
Robin appeared out of a cloud. I get a bit emotional about this one. I was so glad to see her.
It's 3 months later, and by wearing a back brace, Rex has avoided a risky back operation, but he's still recovering from major surgery to his leg.
When they put the titanium nail down the leg, they had to go in from behind the knee, and then they had to sort of dislocate the knee and put a drill down there, 12 millimetre, right down the middle of the shin bone, through both pieces and then pin them.
That was a major concern, that he may not be able to walk again. The flowers are beautiful, aren't they?
They are good.
Fortunately, he is. Each week you could see him get better. To start off with, he got rid of the brace for his back and was just walking with his moonboot. He's done very well for an old fella.
Happily married for 57 years, Robin has always supported Rex's passion for motorbikes.
That a heavy hit on gravel, that's a heavy hit to do that.
But Rex is now hanging up his helmet and leathers for good.
The good sense part of my brain, which is a very small section, said to me, give it up, give it up. You've done well, you've crashed your way through 60 years. That's enough.
gunshot to neck, lots of bleeding, 15 minutes.
At the Royal Melbourne Hospital, a call has come through from paramedics rushing a critically injured man to emergency.
We got a gunshot wound coming in 15 minutes, shot to the neck, who's lost a fair amount of blood. Oxygen levels are low.
Emergency Dr Michael Dunn moved from Ireland 18 months ago with the dream of finishing his medical training at a major trauma hospital like the Royal Melbourne.
I had no family connections or friends over here. It was certainly a big move and a scary move at the time, but I wanted to do emergency medicine. I only heard great things about the Australian healthcare system, so took the plunge.
Multiple holes in the neck, apparently. Sats 80, heart rate 120.
Director of Emergency Mark Putland has been a physician for 20 years. He's seen more gunshot injuries than most doctors in Australia, having spent time in the US hospital system.
I was in the States for 4 months. I was observing, looking at trauma systems and how they work. There, it's a daily thing. So we have to really work hard to bring the whole system together and make sure it works well for this.
What do you want me to do?
You want to do the right chest tube.
Yes.
They will be prepared for that and get trauma to the left.
Yeah.
Because we should assume that they're going to need one of these. Gunshot wound to the neck is a very high risk injury. There's a lot of important structures very close together in the neck. Potentially major vascular injury, so the big arteries, veins running up and down to the brain, which has pretty dire consequences, both in terms of supply to the brain and just loss of blood.
Dr Mark is gathering a crack team of specialists to treat the gunshot victim.
G'day, how are you? My brother and director, how are you? So I'm going to team lead. Rose is going to provide surgical expertise to the procedural people because there's potential for a bit of procedural. You're what, ENT, did you say?
Yeah.
Hence the glasses, great. We also had the head of anaesthetics down, which is fantastic, probably one of the best people to be managing that upper airway they've got in the whole place. Has everyone got face masks on? There's a lot of external bleeding from this neck, according to the radio. That could be spurty. Everyone's elevated, everyone's a bit nervous. And I mean, it's important that people take that nervousness and turn it into a positive feeling for themselves, because that same adrenaline, that can be terror or it can be excitement.
You train for this, you train for dealing with the unexpected. You do see things for the first time. So you have to be prepared and dynamic and adapt.
Sats at 80%, heart rate 120, blood pressure 100 on 40, GCS 15. That was about 10 minutes ago. A lot could have changed since then. Lisa, you're in charge of the airway for the time being. When anaesthetics arrive and take the top end, if you move to a potential surgical airway, that'd be great. And Rose will be there to support you with surgical assistance with that. Michael, if you take care of the right finger thoracostomy, David, you're taking care of the left finger thoracostomy. And Thomas, you're going to have a look at the heart and then the rest of the abdomen on the fast scan for us. Thank you. Bullets do a hell of a lot of damage. So anything's possible, but we're prepared for big airway injuries. There's a lot of things that keep a person alive packed into the neck, so it's critical. Just arrived and looking pretty crap.
This is a male in his 50s, no previous medical history, meds or allergies. He has received a single gunshot wound to the left side of the neck, just under the angle of the jaw, with apparent track through to the contralateral side with increasing swelling on the right-hand side. So, airway is my primary concern, although it is intact at the moment. He has increasing dysphagia, presumably to the swelling. There is no external hemorrhage.
So, single entry wound, is it?
There's one hole in his left neck and there's a big swelling on the right neck.
Okay, his trachea is midline, chest is good air movement biliary. Let's get fast on.
Good.
There's a wound to the left side of the patient's neck with no exit wound that I can find. So I suspect the bullet's still within the patient's neck and he could die from that injury.
Up on the hospital rooftop, another urgent case is arriving at emergency. An air ambulance is landing with a young man badly injured in a car crash during cold and wet weather.
Is it really cold in here today?
It's freezing. I've had to put extra gowns on.
Senior emergency doctor Jonathan Papson is standing by with his trauma team.
Sounds like he's gone surfing, he's come back in the rain. Someone's just pulled out ahead of him and he's crashed into the side of them. He's been trapped in his car. He's been stuck in there for half an hour.
Usually when it comes via helicopter, it's pretty serious. It's a serious deal.
Oh, here we go.
24-year-old uni student Taylor was pinned in his crashed van in freezing conditions and is in a lot of pain.
We're going to move you across and have a look at you, mate. All right? You feeling okay?
Oh, yeah.
Yeah, good.
Yeah, been better.
1, 2, 3. All right, 1, 2, 3.
So Taylor's normally well, driving a high A span. T-boned a car that cut in front of him. Got full recollection of the event. He was trapped for about 40 minutes. The first ambulance crew arrived, so he was sort of spread eagle over the top of the steering wheel with his chest resting on it. There is some damage to the steering wheel as well.
Okay, all right.
Injury-wise, is apart from a little bit of bleeding from his nose, there's no obvious injury to his face, to his head.
Yep.
Neck's got no pain.
Got the wound on the leg.
Is an injury in there, which looks like a bit of dashboard's gone in and out again, and just a steady ooze of blood coming out of it. He has a little bit cold because it was quite cold.
Yeah, cold and wet.
Taylor's very lucky. A lot of people wouldn't survive this sort of crash, especially with the country road, high speed, wet conditions, older car, you know, roll the dice.
Taylor's father arrived at the crash site as his son was being cut from the van. His parents are on their way.
Does that hurt? No. Did you hit the steering wheel with your chest?
Oh, I'd assume the airbag didn't go off, so...
You had a seatbelt on?
Yeah.
Does it hurt when you breathe?
No.
No. Did you hit your face on something?
Probably the steering wheel.
With no other obvious external injuries, Dr. Jonathan turns his attention to Taylor's leg, which had been bent up against and then pierced by the dashboard of his crashed van.
So it's probably broken, isn't it? A little bit of ooze coming out.
Is that sore, mate?
No. Looks like an open fracture bleeding.
So an open fracture is where the fractured bone is exposed to the environment, which means it's just going to get infected unless you do something about it. And it's a bad thing to happen.
The injury is potentially devastating for Taylor, who works as a surf coach and has important uni exams coming up.
And your leg's quite sore, yeah?
Yeah, both of them.
Yeah, both.
What about those toes? Yeah. Well, yeah, that's my big toe. The toes really sore. And the neck.
Both toes numb? Both feet? Or one?
These are sore. Those are kind of numb.
Does that hurt?
No.
For something like this, what are the real problems going to be? It's going to be chances of infection. Is there a problem with the blood supply to the toes? Has the main artery down there been compromised by the fracture, by the bones moving?
So the fast is looking normal and the chest looks normal.
If it's an open fracture, which means he's got bone poking out, then there's always a potential of amputation. So there's always a potential that he's going to lose his leg. That's the real deal here.
This is a male in his 50s. He has received a single gunshot wound to the left side of the neck, just under the angle of the jaw.
At the Royal Melbourne Hospital, Dr. Mark Putland and his trauma team are trying to save the life of a man shot at close range.
Let's assess his chest and abdomen the normal way. Minimal handling around his neck, and we'll let anaesthetics have a look and we'll make a controlled plan at whether or not we secure the airway now. His main issue initially was his airway was a bit threatened. You get a big swelling developing from that pushes your windpipe across to one side.
The risk with this sort of injury is that the only thing keeping the man's airway open is his own muscle tone and his own, basically, he's sort of clinging on to life.
What's the front of the neck look like if it comes to it, Michael?
The front neck looks okay, actually. It's all predominantly the side of the neck, yeah. Shouldn't be any issue. I think we need to go surgical airway.
A surgical airway involves making a cut into the throat so the man can breathe through a tube. But it's a very risky procedure, as the doctors haven't found the bullet. Dislodging it could be catastrophic for the patient.
Point here and no exit with swelling on the other side, so it's obviously trapped.
You've got a lot of experts in a room, and we've got to make sure this is an orchestra, not a jazz band. Now, Anita's had a good look with the little video, and we decided to get the surgeons to make a cut to the front of the neck and put a tube in that way. All right, some local anaesthetic with adrenaline. OK, so team, the plan at the moment is the ENT surgeon's going to do an awake local anaesthetic, front of neck access.
An awake is where the surgeon cuts open the windpipe and inserts a tube while the patient is conscious.
OK, scalpel, please.
Yeah, scalpel.
It's an extremely rare procedure, but the swelling of the man's tongue and build-up of blood is suffocating him.
I personally have never been involved in a awake surgical airway before. Typically, it's something that we wouldn't do in the emergency department. It's sometimes done in the intensive care unit when the patient's sedated.
A little bit of pushing on the front of your neck there.
We initially enter under the Adam's apple, and the tube would probably go in about that far. It's extremely distressing and uncomfortable for the patient. It does temporarily give the feeling like they're choking, but it's life-threatening and a life-saving procedure.
He is getting agitated. That I feel uncomfortable about, I must say.
Bit of pushing it, you're doing very well.
Is the tube in?
Yeah, tube's in.
Tube's in. Get him off to sleep, Michael. Get him off to sleep. How much will I give him? Give him 100.
The airway is secured, but the trauma team now has another crisis on its hands.
Arterial bleed?
Yeah, arterial bleed at the base of the neck.
How old are you?
24.
Over in Trauma 1, Dr. Jonathan Papson's patient, Taylor, is waiting for the X-ray results of his right leg, which was severely injured in a car crash on his way home from the beach.
Because you're going how fast? Like 80, 100? Or?
Realistically, probably 90.
90, yeah.
The X-ray results are ready and confirm Dr. Jonathan's suspicions.
So he's got a fractured shaft of the tibia, which is not a good injury to have. Because it's open to the environment, you can get an infection from there. So it's actually quite a serious injury to have. If it gets infected, that's big trouble.
It's a broken bone under there.
Yeah, right.
And you can tell because you see how the blood's like a little bit fatty? It's probably coming from the middle of the bone because it's got marrow.
Jonathan calls in specialist orthopaedic surgeon Dr. Patrick Elias to see what can be done to save Taylor's leg.
It looks like it's open, so it's a grade 1. This is a pretty significant injury, and the complications associated with this can be limb-threatening, so we need to do an operation on this as soon as we can and insert a metal rod down the bone and use some screws to secure that rod.
We're giving him antibiotics, we're going to wash it out, but there's still a high chance this leg of his is going to get infected.
Just a wave with that?
No.
Taylor's parents, Maury and Joelle, have arrived to see their son.
So you guys just give us heart attacks, you do? Which one? You and your brothers?
Taylor phoned his dad while he was still trapped in the van.
I was doing some gardening and the phone rang and Taylor just said, "Dad, I've had a bad accident and I think I've broken both my legs." I said to him, "Call an ambulance," and he said, "We already have." And then he told me where he was, so I said, "I'm on the way." Driving down there, I tried to ring him back and he didn't answer his phone. That's where I was thinking something terrible's happened. I got down there and, there were police and ambulance, everybody all around the place. And the car was just absolutely written off. He was pinned, his legs were pinned in the van, and it took them a while to cut him out. They had to obviously cut the van and that, and he was in a fair bit of pain. It was cold, it was raining, it was just a shocking day.
People lose their legs all the time in crashes like that. I've seen the van, he could lose his leg. We will do everything we can to make sure that doesn't happen.
Any questions about it?
Orthopaedic registrar Dr. Timothy Chung prepares Taylor for the major surgery he's facing.
I think there's some risks involved. Our hope is to give you one operation, which is rods, then recovery of about 6 months.
It's overwhelming news for the surf coach and uni student whose life will be dramatically changed by the accident.
So, what do you do for work? Surf coach, but I'm a student. So you're about 6 months away from being able to surf.
It's going to be awful for him not to be able to do what he loves doing. It's totally unexpected. It's come out of the blue. It might be totally devastating for him. That's his job.
Doctors will need a CT scan of Taylor's broken leg to see the full extent of his injury before he goes to surgery.
He's going to have pins and an external device put on his bones to hold the bones in place. And then he's got a wound there that needs to be cared for, and then you've got to worry about all the other things, the tendons and the arteries and the nerves that might have been injured as well. So it's much more complex.
There's a trauma coming in. Did you want to take it, Maya?
Dr. Maya Cubitt's heading to the resuscitation unit to meet a patient being brought in by paramedics.
He's young, he's 45, he's fallen over a few times, and they wouldn't normally call this in because all of his observations are completely normal. So there's possibly something that they're worried about that I'm not gathering. Maybe they're really worried he's got a head injury.
In her 5 years at the Royal Melbourne, Dr. Maya's cared for hundreds of people from all walks of life.
I think there are some patients that touch a nerve more than others that will take you by surprise.
Police over the ambulance.
Oh, you like police as well?
Yes.
Ex-boxer Zane was found barely conscious on the floor by his landlady, who called an ambulance. He's chatting happily with paramedics as he arrives in Resus Bay 1.
These are the legends, you know, really, eh?
Thanks, mate. You seem like a bit of a legend yourself. So this is Zane. He's been found in a courtyard area, bleeding from the head, and the lady that he lives watched him fall over 2 more times. He has no real event recall about what he's been doing this morning or why he fell or what he's hit his head on. He's got quite a deep T-shaped laceration from the temple, but back towards the ear down here with a gaping wound. I can't see that's fractured, but it is quite.
Yeah, appreciate it.
Yeah.
Thanks very much.
Ready, set, go.
Hi, Zane. I'm Maya. I'm one of the emergency doctors.
Hi,
I'm wearing funky glasses.
I was going to say, Jesus, you're trendy.
Yeah, super trendy. Do you have any understanding of what happened this morning? The paramedics have said you didn't really have much of a recollection about what happened.
No, I just had a few drinks with me mate, and then when I got up, I sort of lost my balance accidentally. I got up too quicker than I should have, and that's where I hit my head. Hit my head, that's all.
When did you have the drinks, buddy?
Last night.
Last night. Do you remember how many you had?
Oh, I don't know. We had like 1 bottle of red wine and a couple of ports.
Okay.
If there was no alcohol in our world, I would have a lot less things to do as an emergency physician. Alcohol is a big problem.
Do you drink alcohol every day or just some days?
Nah, some days.
Some days.
I don't drink every day.
All right. And when you drink, do you drink a lot or a little bit?
Nah, not much.
Not much. What's not much?
Oh, I might have a bottle of red wine, and if I drank the full bottle, that would be a big day.
Right, okay. I suspect Zane is, in colloquial terms, pissed as a newt at some point overnight. So Zane has had a lot of alcohol, which has caused him to fall over and give himself a really nasty head injury. You'll notice we've left him lying flat just in case, because I'm not sure what his blood alcohol level is, but if his blood alcohol is still really high, then my clinical examination isn't as reliable, so I'm a little bit more cautious about how I manage them. So Zane, I just want to have a look at this wound on your head and just make sure that you're not bleeding under that bandage, okay?
Zane's a retired professional boxer with more than 140 fights under his belt. He's fallen down drunk 3 times, hitting his head and causing a deep gash from his temple to his ear.
Have you got a headache? Sorry, buddy. It's a pretty nasty cut, buddy. I can see your skull.
Arterial bleed? Yeah, arterial bleed at the base of the neck.
Over in Trauma 2, doctors Mark Putland and Michael Dunn and a highly specialised team are battling to save the life of a man shot in the neck.
How much volume are we getting out into the suction?
Doctors made an incision in his throat while he was awake to insert a tube to help him breathe. But the rare procedure has triggered another potentially lethal problem.
After securing the airway, we realised that the patient has some arterial bleeding from a small artery higher up. This is certainly an extremely dangerous situation for the patient. He is essentially fighting for his life, and the interventions that we do have to be done quickly and have to be done correctly.
I'm going to start the O-neg now that we've got external bleeding in significant volumes before he gets into more trouble.
We're just going to pack it now.
Just going to pack him in theatre.
The bleeding means it's too dangerous to do a CT scan to find the bullet.
Just hook it up and you're ready to go. He's got significant external blood loss now.
Time's running out for the patient, and he must be rushed straight to emergency surgery.
All the activity dislodged a bit of blood clot. Plus his blood pressure went up in response to what we were doing. It was a bit stressful for him, so that may have stimulated a bit of bleeding. So then they precipitated a change of plans. Rather than secure the airway and go to CT and see what damage is done, it was secure the airway, go to theatre. Let's go. And I might just come up just to see that everything's good.
Oh, it was pretty intense there. Thankfully, the airway is protected now, so he's going up to theatre to have some bleeding addressed.
The emergency team has stabilised the man, but he remains dangerously ill.
This is one step in the process of actually treating the patient, so his life is still very much on the line.
Hello, Royal Melbourne ED, Maggie speaking.
We have a 43-year-old male patient who sustained a fall from a piece of industrial equipment today, approximately 2.5 metres tall.
It's now late afternoon, and senior emergency doctor Sarah Whitelaw and her team are receiving a call from paramedics rushing to emergency with another man who's fallen, this time from a height at work.
At the moment, presenting in quite a lot of pain.
Royal Melbourne received was in approximately 10 minutes.
They're not that far away, a few minutes, so we'll go into trauma 1. We'll draw up some ketamine. They said he's in lots of pain, so I think we should probably have that drawn up by the time he gets here.
The man landed on his feet, and Dr. Sarah and Nurse Maddie White know this kind of fall can be fatal.
If you fall from more than a couple of metres, you can have life-threatening injuries. Certainly, if people land on their feet, you can have broken heels and their lower back can absorb an enormous amount of force.
Ready, set, go. Ross was at work today. He was climbing off the back of a compactor, which was about between 1.5 and 2 metres tall, where he's lost his footing and he's landed on the ground on his feet, followed by a secondary strike to his bottom. He's got back up after a period of time, went back to work at about 8 o'clock when there were others at work. He was in another machine and he started to complain of some altered sensation in his feet.
Dr. Sarah needs to quickly find exactly where the 43-year-old's pain is coming from.
Whereabouts is most of your pain?
My lower back.
Okay.
My groin, my hips, ankles.
Okay.
Incredibly, Ross went back to work after the accident for 2 hours, and it wasn't until his workmates arrived that he was persuaded to go to hospital.
Just don't move your neck or your head at the moment. I'm just going to have a feel. Are you sore? That's really sore, isn't it? Okay.
Can you rate your pain out of 10?
When you move me, it's 10.
10.
The team start a battery of tests: blood, ultrasound and x-rays.
I'm worried about injuries where Ross is complaining of pain, particularly in his pelvis and his groin and his legs. What I'm worried about is there a fracture in that area, particularly pelvic fractures that can be associated with huge blood loss and can be life-threatening.
I'm going to pop some cold goop on your belly and we'll have a look.
Got a pain in my lower back.
Yeah, we're getting some pain relief for that right now.
Deep breath in for me, mate. Deep breath in.
We're just going to put a collar on.
Hold your head nice and still, okay?
The ultrasound isn't showing any obvious injuries or bleeding to his abdomen.
X-ray.
But Ross's severe pain is pointing to a serious injury somewhere.
We are going to roll you onto your left side and examine your back. Just keep really still for us. 1, 2, 3. Is that sore up the top of your back? Is that okay?
Yeah, there's pain down there.
That's pain, okay. All right, what about down here? Is that sore in there? 1, 2, 3. Where is that in your lower back? Yeah, that's right there.
My groin. Oh, my groin.
So the idea is we're going to put this on. It won't hurt as much, but it will just hurt a little bit as we do it. So you're doing well.
Dr. Jonathan Papson's patient, Taylor, is being prepared for major surgery. The 24-year-old surf coach is in danger of losing his leg following a serious car crash. Taylor's badly broken limb is being wrapped in plaster to keep it stable until he goes to theatre.
Trouble is when you lift the leg up, the bone sort of sags a bit, and that obviously hurts. You remember the fracture, there's a jagged bit. So I don't blame him for being uncomfortable. So I can hold the plaster if you want to get the bandage. So you've got the foot.
Any lower limb injury that's open to the environment, if it gets infected, you lose the leg or you lose part of the leg. That's the real risk. So there's a risk of infection, and even despite antibiotics and the best possible treatment, it can still get infected.
But we just have to have it like that because it needs to be in the right spot.
His dad, Maury, is worried about the impact on Taylor, who's studying environmental science and about to sit exams.
There are some memories in my mind, some pictures in my mind that will stay with me forever. You know, just below the vehicle, you know, there was this puddle of oil and blood and rainwater all mixed in, and that was just a horrible thing to see. It'll be no different for Taylor, though. He'll have some horrible memories as well.
Someone's looking after me. I mean, I saw a picture of the car and it's amazing I've still got legs left, to be honest.
Dr. Jonathan has done all he can for Taylor. He's now going to theatre for surgery to try and save his leg.
My groin! Oh, my groin!
Back in Trauma 1, Dr. Sarah Whitelaw and Nurse Maddie White are still trying to find the cause of Ross's excruciating pain. The landfill worker fell 2 metres off the back of compacting equipment, landing heavily on his feet.
It's what we call a decelerating force, which can cause injuries throughout the body, and certainly people can have life-threatening injuries.
Bring your toes towards your nose. That hurts your groin, does it? Okay, all right.
Dr. Sarah's worried the 43-year-old has massive internal bleeding.
If someone's complaining of a groin pain after a fall like that, there's bones at the front of the pelvis called the pubic rami. The pelvis is actually a bone in the body that essentially holds your spine and your legs together. If they're both broken, then sometimes the pelvis itself can kind of come apart. And there's big blood vessels that go alongside the bones, that when the bones get broken, sometimes they can shear the blood vessels, and you can certainly bleed to death from a pelvic fracture that way.
It's an incredibly frightening time for Ross. He's only just returned to Melbourne to help his mum after living in Canada for 18 years.
Must be a horrible day for you.
Oh, why do you think it was so bad?
Yeah, I know. What happens after these sort of injuries is your body has natural adrenaline pumping around. So it masks a lot of your symptoms until you relax a little bit and realise what's happening.
Adrenaline can make you do incredible things. People will do inhuman things, you know, lift cars off people. So I feel like Ross today, he's had this incredible trauma and then he just got up to do all the normal things, but then he's now realised he's in a bit of trouble.
Are you able to bend your knees?
They're bent, aren't they?
Okay. Does it feel the same on both sides?
I can't feel them.
I'm really concerned about that lower back.
I know that if Ross has lower back fractures, it's really crucial that we get Ross comfortable enough to be able to stay still and make sure that that doesn't become a spinal injury that makes him into a paraplegic.
With his pelvis strapped to restrict movement, Dr. Sarah prepares pain medication so she can get on with the examination.
All right, darling, little sting, okay? Ready? 1, 2, 3. Doing very well.
Ketamine, it's a disassociated anaesthetic that you can give in pain, and it just takes your mind away from the actual injury and the pain itself.
But some patients react to the drug in unusual ways.
Just keep breathing, darling.
Ross is extremely agitated and he's not coping at all.
What the is going on?
Oh, look. The world looks different when you're sitting upright. Feel a bit dizzy sometimes when you've been lying down for a bit. You okay?
Just start counting to 10.
At the Royal Melbourne Emergency, Dr Maya Cubitt is treating former boxer Zane, who has a deep gash in his head after falling over while drinking with a mate at home.
In the next little bit, I'm going to have a look at your head and see if I can stitch it up myself. You've got a few other scars on your head.
142 fights.
Yeah.
The 45-year-old has escaped any other injuries, but his head wound is much deeper than Dr Maya expected.
You will have a scar there, but I'll do my best to keep it beautiful.
I don't need you
All right.
to do much with me, Doc.
Earlier, Zane told Maya he'd drunk a bottle of wine and 2 glasses of port, but his blood test results tell a different story.
So your alcohol level is quite high, like, I don't know, 5-6 times the legal limit.
A few red wines last night. I don't normally drink red wine.
Yeah. I think you were a bit more drunk than you realise, hey? Do you do that very often? No, okay. So this is the sort of slightly mum side of things. You were a lucky guy. Probably had a bit too much to drink last night, I think.
I didn't harm anybody, I myself.
Yourself, exactly. And so that is my worry, though. I just want to make sure that next time you don't hurt yourself in a more serious way, okay?
Thank you.
Yeah, okay.
I think Zane is ready to have a bit of a conversation around the fact that the way he was using alcohol wasn't that safe.
How's the agony of defeat? Oh, it's got a name where they...
You keep talking, I'm going to stab you with a needle and it's going to sting. Sorry.
Can't even feel anything. I wish I had that when I was fighting and playing footy.
Have you had a lot of stitches in your life?
Millions.
It's quite peaceful doing stitching.
I know I've done it.
To yourself.
I love suturing because you take a piece of a person like Zane that's broken and you put it back together and you make it look whole again. And it's very satisfying to do that.
Well, any head injury is not a good head injury, huh?
Oh, I've had plenty of them.
I know. It'd be hard for me to convince a boxer of that.
Yeah, people say that boxers lose their memory, but I've got a memory like a
My daughter's into telling jokes. Her favourite one at the moment. Why did the biscuit go to the doctor?
Why?
He's feeling a bit crummy. She'll love that I told you that joke. I think we're done. I'll take a photo of it and then I'll show
gone
you.
too far, haven't I? Really? There's no more modelling contracts. Jesus Christ, it's worse than I thought.
Yeah, you did a good job.
I need to kick up the arse.
I do think as an emergency department doctor, it is definitely my role to highlight that the way people are using alcohol is leading to their medical issues. I hope we can start a conversation that somebody else helps them finish.
Well, if coming into hospital because of the alcohol isn't enough to do it, nothing is. I was going to see if my drug and alcohol nurse could come and have a chat with you. Do you feel open to a chat?
Oh, yeah.
Everybody makes mistakes and bad choices at times, and we all need our community around us to recognise when we're in a place that we need help, but also to challenge us to be better.
See you later, then.
Well, I thank you very much. Really.
No problem, no problem.
If you ever need anything from me, just ask.
You're a kind man. Thanks, Zane.
If somebody was to come back to me and say, do you remember 5 years ago you looked after me in the emergency department and we had that chat, it made me go and do something about it. I would hope that if I have 100 of these conversations, one of them results in somebody changing their behaviour and doing some hard work, which it is, to achieve that.
You're all right. It's okay. Yeah, you're okay. You're in the hospital.
What the f is going on?
Down the corridor, Dr. Sarah Whitelaw's patient Ross is having a violent reaction to the pain-killing drug ketamine.
I'm scared.
Dr. Sarah gave the 43-year-old landfill worker the strong analgesic for his severe pain after he fell 2 metres from machinery, landing hard on his feet.
Sometimes they can see frightening things, they can feel like they're having a nightmare, they can feel agitated and stressed and anxious. So there's lots of things we can do to help with that. And one of those things that's really effective is just creating a bit of a calm, reassuring environment.
What happened to me?
You had a fall, mate. You
When?
had a fall. I think at work.
Oh,
Take care of you. We're going to look after you. Okay?
Ross, do you have family at all?
just my sister.
Does your sister know you're in hospital today?
Oh,
So you're living on your own at the moment?
yeah, I've only been here 2 months.
Dr. Sarah still doesn't know what's causing Ross so much pain. She's very worried that the loss of feeling in his legs could be a spinal injury, which could cause paraplegia.
Oh,
I know, and you feel a bit awful.
oh, it hurts.
So they can get on with further tests, Sarah decides to give him fentanyl, a powerful painkiller.
I'm just going to give you, not the other stuff that I gave you. 20 mics.
You're okay, Ross.
The fentanyl works, and with Ross's pain finally under control, Dr. Sarah reviews his blood test results.
The other thing that worries me a little bit is this gentleman's blood count is quite low, much lower than we would expect.
And the x-rays reveal more bad news.
I'm worried about this gentleman's lower lumbar spine and what we call his sacrum. I'm going to organise a CT scan for you. I'm worried about something going on in your lower back and your pelvis.
His blood count is quite low, much lower than we would expect for a man of his age. So I'm really worried at the moment that Ross might be bleeding from a pelvic fracture, and we need to get a CT and work out if that's what's going on.
It's Ross trauma when.
In the CT scan room, the team move Ross gently to the machine.
We're gonna just slide you across, okay? Well done. Good job. Breathe. Ross, breathe.
There's obviously something going on. He's got a lot of pain, but what I'm looking for is big pelvic fractures or lots of bleeding from that area, or a big fracture of his lower back or an injury to the spinal cord.
Hey, Ross.
While Ross waits for the results of his scan, a workmate arrives to check in on him.
Pretty sore, man. Yeah.
Is anyone on the call?
Oh, my sister. I was sweet. He says. I'm worried about my pelvis, my lower back, because of the shock when I fell, because I fell so high. Tell Mum it's all right. Love you.
Yeah, that looks chronic, doesn't it?
Ross's tests have uncovered an unusually low blood count, and his CT scan results are not what Dr. Sarah expected.
Ross is extraordinarily lucky. He's in a lot of pain, and that means that he's obviously got some bruising and soft tissue injuries, but he appears to have got away without any of the really big injuries that we were worried about. He does need to get his low hemoglobin followed up though, because it's lower than normal, and we need to go looking for why that might be.
Dr. Meyer's patient, former heavyweight boxer Zane, was brought to emergency with a deep gash in his head after falling over when drunk.
I can see your skull.
Meyer stitched the head wound, and after a night in hospital, Zane was discharged. He then made an appointment to see a drug and alcohol counsellor.
50-year-old male, gunshot wound in the neck, multiple holes in the neck, a lot of external bleeding.
Dr. Mark's gunshot victim was clinging to life when emergency doctors performed a rare procedure to let him breathe.
Tubes in, get him off to sleep, Michael.
Following 6 hours of surgery, the man went to intensive care. Thanks to the surgeons, he survived and was discharged from hospital a week later.
Are you sore? That's really sore. Okay.
It was good news for Dr. Sarah and Nurse Maddie's patient Ross, who was cleared of any serious injuries after a fall at work that left him in severe pain.
Oh, my groin!
The 43-year-old landfill worker was kept overnight with suspected neuropraxia, a type of nerve injury which generally improves over a few hours.
With Ross, it was a good outcome. Every trauma is very different and could have been really, really bad, but Ross got lucky.
He went home the next day with painkillers for his soft tissue injuries. When surf coach Taylor was airlifted to emergency with a shattered leg from a high-speed crash, Dr. Jonathan was concerned there was a risk of amputation.
If it gets infected, that's big trouble.
Jonathan cleaned and plastered Taylor's badly broken leg before an operation to try and save it. 3.5 months later, the uni student isn't back riding the big waves yet, but he has managed to dip his toes in.
So I went from not being able to take a single step, and then I actually went for my first surf yesterday. So that was pretty exciting.
His leg was saved after marathon surgery where a titanium rod was inserted from his knee to his ankle.
This experience definitely has changed my outlook on life. I think this accident has strengthened my relationship with my dad. Like, he found it really difficult to be at the accident site and to see me in that situation.
It probably gives us a good outlook on life now. One of the police guys at the thing said to me, you know, someone up there was looking after him, and, you know, we truly believe that.
I called the rural clinician. So I rang the clinician. He told me to call the rural clinician. The rural clinician said he would call me back.
At the Royal Melbourne Hospital's emergency department, husband and wife doctors Maya Cubitt and Bjorn Macon are discussing their workloads.
Coming into Resus 3, I'm getting a trauma that's coming in now. So I may or may not be able to do both of them. I met Bjorn when I was in second year of university, so we've been together for 20 years now.
He has a different skill set to me. He approaches problems thinking about them in a different way.
Thank you.
No problems.
And that's really valuable to me, to be challenged constantly about how I'm thinking. Could I do it better? Am I missing something?
I didn't know that Bjorn was doing your stuff.
Oh, didn't you? You know, we keep that quiet. It's hard, isn't it, when we all have different surnames?
Well, and then, obviously, and it's just a test to you guys, you're keeping a really professional.
Yes. Yes. We're very professional.
Super.
We like to think we are. There's no Grey's Anatomy here.
Dr. Meyer and her team are standing by for a severely injured 43-year-old man arriving by air ambulance from country Victoria. He's fallen 3 metres from the top of a shipping container.
Lots of pain in the back?
Yes.
Lots and lots of medication to control severe pain.
The patient's pain could be a sign of head and spinal injuries.
So, concerns about whether the lots of screaming and pain is head injury or injury to musculoskeletal spine.
Father of 3 Matthew was clearing a fallen tree on his property with a chainsaw when he fell.
Just a few bumps as we come across.
Even though paramedics have given Matthew multiple doses of powerful painkillers, he's still in excruciating pain.
You're at the Royal Melbourne Hospital, mate. Do you remember what happened? No.
Pain gives us a flag that there's something going on, and the way that we approach him is to try to figure out if that, in the next 20 minutes, will be the thing that might kill him.
All right, so this is Matthew. He was on top of a container trimming a tree with a chainsaw. When the limb that he was cutting fell, the chainsaw fell free and he fell landing on his coccyx. Head to toe, the only thing we found and the only complaint he's had is this back pain, type area, severe in nature.
Matthew's partner saw the accident from their kitchen window and called the ambulance. She's now on her way to the hospital.
He's had a heart rate about the 80, sinus rhythm throughout.
Dr. Meyer's worried about the level of pain Matthew is in.
Matthew. Hi, I'm Maya. I'm one of the emergency doctors. It's nice to meet you.
How are you?
So, You've had a lot of ketamine and morphine.
Yeah.
It's quite a lot. I'm not the police, okay? But I just need to know, do you normally use things? Because it might change how much medication we need to give you to control your pain. Do you use heroin or ketamine or injectable drugs normally?
No.
No? Okay.
Whenever somebody has pain out of proportion to what I expect, one of the things I need to do is, what have I missed? What diagnosis am I missing here? And having a good history about what other drugs the patient's using that might affect what I'm giving him.
I think we should roll him, see where he's sore.
1, 2, 3. Any pain here? You've got pain. Here? Matthew, have you got pain?
Huh?
Matt. 3. Well done.
So the only outstanding issues for us are we have no explanation for why he's got so much pain.
Dr. Meyer needs to find the source of Matthew's searing pain quickly and orders x-rays.
I'm prioritising looking for other things that I know might be life-threatening.
We might get some fluids, that's all right.
Over in Trauma 1, Dr. Michael Dunn is preparing for the arrival of a man being rushed in under a heavy police escort after he was sprayed with bullets.
So we have a patient coming in who apparently has multiple wounds to the face and upper chest. So the concern is that there's all fragments into multiple places and cause damage.
With the extent of the man's injuries unknown, Dr. Michael prepares for every possibility.
With gunshot victims, they can deteriorate in an instant. So where they've been shot, how many times they've been shot are all critically important. Different guns will also have different risks. So a handgun will leave a single tract most likely and oftentimes don't have exit wounds. A rifle would more likely create an exit wound, where shotgun pellets tend to disperse in multiple places. We have to be on high alert and ready for the worst case scenario when they arrive.
Next one. Keep going, keep going. Yes.
Looking at him, it's a little bit hard to find all the wound.
Is there a reason we're lying face down?
He's not.
Sure.
Okay, so if we can transfer across the bed and then we'll listen for handover, please.
That's it. Well done. He's been in his car. Obviously, he's been shot at. Multiple bullet holes to the car. The car's then sort of rolled to a stop. He's self-extricated, walked into a nearby house, called 000. First crew found him on the couch with obviously multiple bullet holes. He's had 50 mics of IV fentanyl, which actually calmed him down quite well.
Thank you very much.
Although the man's been shot multiple times, he is conscious and Dr. Michael can speak to him.
Open your eyes for me. Can you see me okay, yeah? I think it is important that the patient realises that we're not there to judge them, we're only there to treat them.
Equals are equal to 3.
It can be quite scary and quite nerve-wracking, but we have to try and control the adrenaline, control the nerves, and just focus on the patient. So while some people may appear calm in a situation, every single person's heart is going extremely fast in that room.
No obvious long bone injuries.
The priority is for us to have a look at the back just so we can clarify exactly what was there. Okay.
1, 2, 3. Let us do all the moving, mate.
The emergency team needs to quickly find the bullet entry holes and see if any bullets have exited the man's body, or if they're still lodged inside.
Oh, there's one in sort of the middle, the one on
the left upper shoulder.
Left upper shoulder.
On examination, we find that there are 3 significant wounds. One to his left shoulder, one to his upper back in the midline, and also one to the right side of his head.
He's got a gunshot wound to his right temple with a large hematoma over the right temple.
The hematoma means the man is bleeding around his brain, and there are no exit wounds, so the bullets are still in his body.
At this point, we're quite concerned that he has possibly some brain injury, possibly some damage to his spine, heart, and lungs.
Squeeze. Squeeze. Squeeze.
Yeah.
Squeeze on this side.
Yeah.
Right, not
There's
squeeze
nothing.
on the left.
Push me with your foot. Push, push, push.
Dr. Michael asks the man to push with his feet so he can check if his spinal cord is working normally. The man isn't responding. It's now vital to find out exactly where the bullets have gone.
I would at this point describe the patient's condition as critical. The bullet wounds are certainly surrounding some significant organs that can cause life-threatening injuries and potentially could lead to this patient's death.
That's not good.
In the Royal Melbourne's emergency department, Dr. Maya Cubitt is treating father of 3 Matthew, who was pruning a tree with a chainsaw when he fell 3 metres from the top of a shipping container. Maya suspects the cause of his excruciating pain is internal bleeding, which could kill him. So the trauma team have scanned Matthew's abdomen and x-rayed his chest.
Oh, that's interesting. Very asymmetric, isn't it? It would be consistent with a supine hemothorax.
The x-ray is suggesting there could be a dangerous bleed around Matthew's lung.
Whenever there's one side of the chest looking a bit whiter than the other, in a lying flat x-ray in a trauma patient, we always get a bit worried that there's bleeding into that chest cavity. But definitive testing is always a CT scan of the chest to find out definitely whether there's any bleeding into the chest cavity and where it might be coming from.
All right, cross on the count of 3. 1, 2, 3.
The CT's higher quality image should pinpoint the exact problem area.
Please breathe in and hold your breath.
The scan finally reveals why Matthew is in so much pain.
Ow.
And it's not what Dr. Maya expected.
There's a fracture there. He's fractured the vertebra in his back. It's basically burst apart. I'm seeing a fracture of the spine. It does put him at risk of other complications. For example, a fracture of your back puts your spinal cord at risk, which of course then puts your ability to use your limbs at risk, and the way that you live your life thereafter is dramatically changed.
The news that he has a broken back will be devastating for Matthew, who is in pain and alone, while his partner, Rowena, is still travelling to be by his side.
This is going to be a bit of a long road. And, you know, while it's hard to hear that, I think he needs to know that so that he can prepare and so that his wife can prepare, because it's going to be hard for them. They've got 3 small children and he's going to be in hospital for a little while and he's going to be sore and he's not going to be able to work. And I think that's tough.
Resuscitation speaking.
Yasna Cardoza has been an emergency nurse at the Royal Melbourne for 5 years and today is in the middle of her shift in the resuscitation unit.
Perfect. I'll get the doctor to tick. Thank you so much.
Yasna often works with her boyfriend, fellow nurse Konrad Dabraskovich.
I love how you never get the same day twice. You always have exciting cases coming in and you see the worst of the worst and the best of the best.
Get you over and we'll get you looked at.
So, on go. Ready, set, go.
Nurse Yasna is admitting father of 2 James, who's just had a freak accident at home.
Oh, did you hit your head at all? Too sore?
That's all right.
Do you want to go lower?
That's fine. I hit my head in the shower screen, but when I dropped
Forward.
backwards,
Yep.
I had my hands down.
Okay.
James slipped backwards in the shower, cracking the screen before falling onto it.
Was it glass you think that you've cut or glass?
As soon as I broke the glass, my back started getting pain. I'm going, did the glass stab me?
Yeah.
Or I got cut?
Yeah. So when I first meet James, I sense that he is terrified. He's scared of what's going to happen. At this stage, we know that he's fallen back in the shower and he's heavily bandaged. We don't know what's underneath and we have to find out.
Are you allergic to anything, mate? No.
James and his family had been celebrating his son's 8th birthday earlier in the day.
I was having a shower. As soon as I put conditioner, I used too much. Next thing, I slipped backwards. Before I got up, now I got something pain in my back. It was a big shock. I was like, did I get stabbed or did I get cut? My mum had a towel in my back holding so the blood doesn't keep pouring. Next thing, the ambulance came.
I'll take all these off now. I'm sorry, sweetheart.
Nurse Yasna notices his bandage is beginning to fill with blood
This is actively bleeding.
and escalates James' case to Dr. Glenn Harrison for immediate attention.
He's just got actively bleeding through his all his dressings, so all the way through the back and the front. Okay.
I'm scared now. I can't move my back because of the cut.
We still don't know what we're dealing with at this stage, but we can tell that through the bandage it's actually actively bleeding. So we'd rather have this looked at sooner rather than later.
So you fell on a shower glass or something?
Yes.
Yeah. You get knocked out or anything like that? Right. I'm going to get you to sit that way a little bit. I'm just going to have a little look, okay?
Dr. Glenn is taking down the bandages. As he's taking down each layer, I can see that there's more blood. As he cuts through the last bandage, we see 2 large lacerations and they're deep. We just don't know how deep, but there's blood everywhere.
Okay, so let's just assess some parts of chain.
Back in Trauma 1, Dr. Michael Dunn's team is fighting to save the life of a man who was gunned down in a hail of bullets.
Can we just get that blood pressure cycling at least every 5 minutes, please?
There are 3 significant wounds in this patient. One to his left shoulder, one to his upper back in the midline, and also one to the right side of his head.
With 1 bullet suspected to be lodged in the gunshot victim's brain, Dr. Michael now needs to find the other 2 bullets with an X-ray and ultrasound.
Just checking for pneumothorax here.
With the bullets still lodged inside, we just have no clear idea on what direction the bullets were going. He was shot once to the shoulder, so we don't know if that's traveled through the chest and into the abdomen.
We've got hemothorax on the left-hand side.
But the bullet isn't in the abdomen. Instead, the patient has a hemothorax, where blood is dangerously pooling outside his lung.
This would indicate that one of the bullets has actually penetrated the lung itself.
And we've got small hemothorax on the left.
If the bullet has penetrated the lung, it could collapse. But that's not Dr. Michael's only concern.
Starter 90%, 89-90%. Can we get a temperature as well?
His hands are very clean.
He's cool peripherally, but we've got high flow oxygen on. Heart rate at 40.
The man's vital signs are plummeting. He's becoming increasingly distressed and could go into cardiac arrest any minute.
Can we get a salt collar?
You've been shot in the shoulder and it's on from the neck. We want to try and keep you still.
The patient is fighting for his life, and the emergency team needs to stabilise him so they can get a body scan.
We have to figure out where those bullets have gone and the track they've taken and what organs or structures they've injured along their path.
All right, let's get in the pain relief and then let's get around to CT.
Are you able to go onto your tummy for me? I want to see both sides.
That side hurts, but I can go this way.
Yeah.
A slip in the shower has left father of 2 James with horrific gashes across his back, and he's terrified.
I'll put some local anaesthetic in there, give you some pain relief, but it's also going to stop the bleeding a little bit, okay? So you weren't assaulted or anything like that? You definitely fell through a glass plate?
Didn't fall through.
Yeah.
I broke it and fell backwards a little bit.
It's worse than what we thought it would be. He'll probably need theatre just to get it cleaned out properly and fixed.
As nurse Yasna Cardoza and Dr. Glenn Harrison inspect the wounds, the depth of the massive gashes becomes a concern.
Is it stitchable?
Yeah. You need to have the wounds cleaned properly and explored. You probably need to have a little CT scan to see how deep they go, okay? Because they're pretty big cuts, and glass cuts very deeply sometimes. You can't see just from the skin.
I'm scared now.
Yep, that's okay. You're allowed to be scared. I'll look after you.
Anything else you need?
We'll just pack those wounds.
Pack it? Yep.
The wounds must be packed with gauze before Dr. Glenn can put in temporary stitches to stem the blood.
You could see how deep they were. You could see his like subcutaneous tissue coming out, as well as you can see like the muscle lining. So that's how we knew how deep they were.
What are you meant to be doing tomorrow?
Work.
What do you do?
I'm an abseiler.
Not tomorrow.
No.
Not the weekend. There's time for things to heal a bit. There's some things I can do for you here. The other things, then the surgeons will need to have a look at this for you, okay? Yeah, you're gonna need to have all the muscles cleaned properly on the inside and stitches. Under an anaesthetic in the operating theatres.
What, inside my skin?
Yep.
You're gonna put me to sleep?
Yep. Correct. That's what I'm trying to say to you.
I don't want to go to sleep, Doc.
That's the only option for you tonight, okay? That's what they have to do.
What happens if I don't wake up?
You'll wake up.
The news has shaken 33-year-old James, who's never been knocked out by an anaesthetic before.
Anxiety plays a big part, especially when, you know, he went to shower. I didn't expect to end up in an emergency department on his son's birthday. You don't know what's going to happen. You don't know anyone you're meeting. You don't know what the outcome will be. So that's why it's really important for us to provide that reassurance.
It's not gonna kill me, is it?
No, you'll be fine. You'll survive this.
You'll survive? Yeah, the doctor's just fixed up his wounds temporarily.
Mum Mila is allowed in to see her son as his temporary stitches are finished.
Oh no, look at the color.
That's fine. That's okay.
Oh, that hurt.
Take your time. No rush. No rush.
Something's stabbing me.
Yeah, yep.
The doctor's stopped the bleeding, which is good. James, pop your hands through here for me. You'll be fine.
Sure?
Yeah. So they're just like big cuts. They're the specialists.
I'm scared. I'm scared of getting put to sleep. That's what I'm scared of.
As Nurse Yasna hands James over to the surgical team, it's time to head home with her boyfriend, Nurse Conrad.
Who's the boss?
Huh?
Who's the boss?
I think you're the boss. The only time where I'm the boss, I think, is when we're driving home.
Yeah.
But otherwise, she definitely outranks me. I'll give her the extra year of experience. It's good. It works for us, at least. And yeah, it's an understanding relationship because we know what we go through each shift and, you know, how challenging it can be and how difficult it is. I'm definitely the more talkative one, I'd say.
Definitely.
Especially after a shift when Yas is more often tired and she's ready to go to bed. I'm happy to have a bit of a chat.
I'm like falling asleep in the car. He's like chatting at me.
But you're always leading the way, so that's fair enough.
On go, ready, steady, go.
Dr. Michael Dunn's gunshot victim has a suspected brain injury and multiple bullets lodged inside his body. An urgent 3D scan should show exactly where they are.
We know where the bullet wound entrances were. We're just trying to see where they ended up. We're doing a contrast scan of the head, neck and chest to have a look to see if there's any injuries to the major structures there.
The concern is that the man may have serious brain damage, as well as injuries to the spine, heart and lung.
Yeah, he does have a lot of contusions there. So that's gone through the lung and out the back, isn't it?
The bullets have travelled at unexpected angles through the body.
That's the skull one, temple, coming down. That's the shoulder one coming down, and that's the back one coming down. So he must have been forward when he was shot.
The bullet that entered his right temple has ended up in the front of his neck, and that's led to some skull fractures, some bleeding, and also some swelling to the brain itself. The bullet that entered the midline or back has actually travelled through the left lung itself, and that's led to some bleeding in the lung. The third bullet has gone in and hit his shoulder blade and seems to have stopped there.
Still under police guard, the man is now being taken back to trauma so he can be prepared for life-saving surgery.
So the next step is putting a tube into the chest so that we can remove any air or blood that's actually pressing on the lung.
Your lungs bleeding. Right, so we just need to drain into those lungs. Okay, so you stand your back.
Probably the most important tract we have to focus on is the head wound, because we know that there has been a skull fracture, there's been some brain damage, and likely there will be increasing brain swelling.
While the medical team continue to work to stabilise the man, neurosurgeons are analysing his brain scans.
Once we open that cavity up, it's going to be really hard to fix.
They are certainly life-threatening injuries. There's a chance that this actually might deteriorate and it may get worse. The next 24 hours are hugely important.
Hey, it's Ben. There's a helicopter coming in. We're saving Trauma 2 for them.
It's a busy day in emergency as another air ambulance arrives with a mother of two who's crashed and rolled her four-wheel drive at high speed.
What would you like me to do?
Senior Dr. Emma West arrives to oversee the gathering trauma team.
You've got something?
Okay guys, so I've got 29-year-old Jess here, who's the driver of an 80 series Land Cruiser today. She's lost control whilst travelling about 100 kilometres an hour. The vehicle rolling 3 to 4 times, and there was significant damage to the left-hand side of the car and the roof crushed down. She's got partial amputations to her right little finger, ring finger and her middle finger.
Jess's severely injured fingers need looking at, but first Dr. Emma has to consider internal injuries.
I can see that this woman is in a lot of pain from a finger injury, and that's where all her mind is, but the car's rolled 3 times, and that's a high-speed, high-impact accident, and it's a really high risk for injury to this person, so we're pretty worried.
But Dr. Emma then finds out there's something else making Jess anxious.
She had a 4-year-old child that was killed in a car seat sitting behind her.
Matthew, it's Maya. So far on that scan, we can see that you have broken one of the vertebrae in your back.
In emergency, Dr. Maya Kubert is telling father of 3 Matthew that he's broken his back after falling nearly 3 metres from the top of a shipping container.
The bad news is it's very painful, as you've already realised. The other bad news is we need to leave you lying flat on your back like this while we try to make sure that there's no other injuries of your spine anywhere else.
It's too early to say whether the spinal cord is at risk from the crushed vertebrae, which could mean he'll never walk again.
We have to be careful about not giving information too early. I'm always really careful just to say what I know rather than what I don't.
Thankfully, Matthew's partner, Owena, who saw him fall with a chainsaw in his hand, has finally arrived.
The drive down to Melbourne, it seemed to take forever. Your mind starts racing about all the things that could be wrong with him, all the things that could have happened or didn't happen.
Hi. Rowena? Yeah. Did you see what happened?
Yes. I remember looking at him for a few seconds through the window with my baby and seeing him suddenly fall. I ran out to that spot and the chainsaw was going really loud, but I could hear him shouting out in pain and found him on the floor.
You're a lucky guy. I know you don't feel like it at the moment, but what worries me is what would have happened if that chainsaw had gone the other way.
Yeah.
Yeah?
I thought too. Very lucky.
Yeah. It is going to be weeks in hospital, plus or minus some surgery, okay? Yeah. Weeks. So there'll be a period of in this hospital, and then there will be a period of rehabilitation, and then there'll be a period at home where we're keeping an eye on you, but you'll still be sore and having trouble moving. You are going to have to deal with the injury that you have, and it is going to be a bit of a long road. My advice to you at the moment is just take it one step at a time.
Yeah.
Okay, so hour by hour if you need to, day by day, all right? Try not to think about the big picture, because it can feel a bit overwhelming.
Yeah. I thought, just brush me up and I'll be right to go home tomorrow. But no.
No.
What a bugger.
Who's with your kids?
Matt's mum.
Okay.
Yeah.
Yeah, how old are your kids?
11, 9 and 1.
Oh, it's always really hard managing kids and life. Because For them, life is going to carry on and you're going to have to figure out how to juggle that. So I would rally in some friends, okay? Yeah. This is the time to ring a friend.
Construction worker Matthew will need surgery to his spine and could be off work for months.
Matthew has a wife beside him, and I can definitely empathise with what that must feel like. I've never seen my husband injured to that extent, but I can imagine what it might be like to sit in her shoes.
This is for you. All right? Thank you.
Thank you. Okay. It will almost certainly result in weeks of pain, and then relearning how to live life, doing simple things like sleeping and not having pain. It is a life-changing diagnosis.
After a shift in emergency, Maya's lucky to have husband Bjorn to lean on.
It's a chaotic environment. We're often emotionally strung out, and to interact with somebody that you know, not many people have that.
As the couple head home to their 3 young children, Bjorn feels the same support.
It is a privilege to be able to work with her, and there is no canoodling in the storerooms.
Thanks.
Can you remember what happened? What's caused the crash?
I got distracted by my daughter in the car.
Back in Trauma 2, Dr. Emma West has heard what must be every parent's nightmare. Car crash victim Jess had her 4-year-old daughter in the back of the vehicle.
4-year-old child. I have a 4-year-old. I feel for her that a child involved in the car accident. It would just be awful.
She had a 4-year-old child that was essentially uninjured and been transported to the hospital.
Incredibly, the young daughter is going to be okay. Dr. Emma can now concentrate on treating Jess's injuries.
Jess, my name's Emma. I'm just going to do an ultrasound of your belly now, okay? And then I'll cover you up after that. She has a partial amputation of 3 of her fingers, so we really need to get going on managing that. But because of the high-impact nature of this car accident that Jess has been involved in, an ultrasound is really important. So we begin with how they're breathing. Sorry, Jess, I'm just having a look at this right chest. This looks a bit different, doesn't it? Initially, on one side, there's a concern that she might have an injury to the lung. Jess, take a big, big deep breath in. Does that hurt in your chest at all? No. Are you sore over here at all? No. Okay. And not up here? No. Okay. No worries.
Dr. Emma's getting conflicting messages. The ultrasound suggests a punctured lung, but Jess has no chest pain.
One of the difficulties with the assessment with Jess is she's had a lot of pain relief and, you know, she really needs it, but sometimes it can mask a hidden injury within the torso.
No pain in the legs?
Oh, my knee, yeah.
I just dislocated it.
So you think there's a fracture in there? Okay.
Emma now needs to look at Jess's partially amputated fingers to see if they can be saved.
Jess, I'm just having a look at your hands now, okay? So you've just got a bandage on there. I just want to have a look underneath and just see what's going on, and then we can get an X-ray. And then I can bandage it back up. It feels a bit better bandaged up, does it? I'm quite worried about the reports of her having a partial amputation. And I know this is going to be really very painful for her. What's your 4-year-old's name?
Chelsea.
Chelsea. And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah. I try and distract Jess by talking to her about her family. And although it's still painful, it's probably, with a bit of distraction, better than it could have been. Do you have other kids?
Oh, yes. Miss Charlie.
How old's Charlie?
7. No.
I've just stopped now. So just 2 kids?
Yeah.
Sorry, Dal. I'm going to have a quick peek and then I'm going to pop it all back on. You never know what you're going to see under a bandage, so you prepare yourself because how you react can have an impact on your patient. I'm just doing it very slowly because I don't want anything stuck down to cause you pain.
What's going on?
Dr. Michelle Thornhill is working fast track today, seeing patients who arrive at the Royal Melbourne Emergency through triage. She never knows who she'll treat and relishes the variety.
If you were in trauma, day in, day out, you'd be exhausted. Each of those trauma cases are quite mentally and emotionally draining. So it's good to mix it with a bit of lightheartedness, a bit of minor injuries in between.
26-year-old Englishman Richard is her next patient.
I'll get you, just have a seat here for me.
He's copped a hit to the head just above his left eye, and just in time for his first date tomorrow night.
Decent one, probably 2 or 3 stitches in there.
Pretty deep, isn't it?
That doesn't really matter how deep it is, because even if it's deep, once it lines up nicely, it should heal well.
The construction worker didn't get in a fight. The wound is kind of self-inflicted.
I didn't think it was that bad at first. I sort of like felt something on my head and I looked down and just dripping blood.
Tell me, what happened? Did you lose consciousness at all?
I literally walked into a wall this morning on the way to work. I just had my head down my phone, checking out the football scores, walked around the corner, and just walked straight into the wall.
Okay.
I've got a video if you want to see it.
I would love to see it.
Yeah. It's the easiest way to explain it.
Oh my gosh! Okay, good. So I can see that you didn't lose consciousness.
Yes.
It's so typical of this generation that your head's down on your phone, not looking where you're going, and you walk smack bang into a wall. I'm gonna put the anesthetic in. That stings for a little bit before it goes numb. Then you get to tell your war stories later on.
Yeah.
Show your scars. I'm sure the girls will like the scars.
Should have seen the other guy.
Dr. Michelle's pretty handy with a needle and thread, so the scar should be minimal.
Pretty good when it comes to humans. Don't ask me to make a dress.
Luckily, Richard doesn't need a frock, just a neat head for his first date tomorrow night.
Do you reckon it'll scar pretty bad, or do you reckon it'll be okay? You can tell me truthfully, I'm not.
I'm just going to have a look underneath. So open, probably open.
Over in trauma, Dr. Emma West suspects car crash victim Jess has serious internal injuries. The young mother is also in danger of losing 3 fingers from her right hand.
The tips of her fingers are partially half amputated. So the finger's still there, but it's hanging off in the wrong direction. They're crushed, bleeding, there's bone and tissue on view, and her fingertips are bent the wrong way. So looking at them, immediately I'm quite worried about the blood supply. Without blood supply, her fingers could die. And then looking at how much of an open wound there is, she's very much at risk of a significant infection within the bone and her fingers. So there's a lot going on there. I'm just going to do one more thing and then I'm going to... all I want to know is, can you feel me touching you?
Yes.
And here?
Yes.
Here?
Yes.
And here?
Yes.
Are you sore over your hand? I'm not going to touch your fingers because I know your fingers are sore. Just your fingers. Okay, no worries. Sorry. When I'm not touching and it's bandaged up, is that more tolerable? Okay. Being a doctor and a mum and seeing some pretty horrible stuff at times, I can be that crazy parent that's always saying, move away from the road, you know, hold my hand. I'm always telling my husband what to do. I think just knowing that accidents can happen at any moment and road trauma is it's just horrible. And I just really hope that a horrible car accident never happens to me or my family, ever. So it's a pretty significant mechanism of injury. So 100 k's an hour, roll over 3 times, squashed roof. Thank God the kid's okay, and she's got maybe something in her leg, and trauma will check with plastics.
With so much going on, including a possible punctured lung, Dr. Emma needs to get Jess to both X-ray and CT fast.
My hand.
If she has any other injuries, I need to know about them now. It'll allow us to look inside and see what the major organs are doing. She's really at risk for injuries to even the major blood vessel of her body, her aorta, and only a CT scan will detect what could be a life-threatening injury.
Almost done, one more.
Dr. Michelle is finishing up the stitches on Englishman Richard's forehead after he walked into a wall while checking the footy scores on his mobile phone.
Rightio. Feel free to have a look before I put a dressing on.
Can I take a quick selfie with you just for the offenders?
Usually I'd say no, but you were pretty entertaining, so okay.
Thank you. I've actually got a date tomorrow as well, so this is going to be a very nice first experience.
I think it's critical to have a good sense of humour in all aspects of life. That's how I was brought up, in a home full of laughter. So yeah, I do find it to be a good bit of the medicine. In addition to treating their illness, you treat their overall mental well-being too.
Dr. Emma's patient, car crash victim Jess, had severely injured fingers after rolling her car several times with her 4-year-old daughter inside.
And apparently Chelsea's fine, is that right?
Thank God for that.
Yeah.
Dr. Emma ordered a full scan of the young mother looking for internal injuries. But thankfully, it showed no damage to her lung or leg. Surgeons operated the next day on the 3 partially amputated fingers of her right hand.
She's had a really good outcome. She's been able to keep her fingers, which is really lucky, you know, to go 100 k's an hour, and it's so great that she was able to have them reattached, keep her fingers, and now be able to use them.
Father of 2 James was taken for a scan, which found the broken shower screen glass had cut through the muscle of his back. He then had an operation to repair the deep damage. After waking up with no side effects from the anaesthetic, he was able to return home to his family the next day.
Looking all right for me. Can you see me okay, yeah?
As for Dr. Michael's critically ill gunshot victim, who was rushed to hospital after being sprayed with bullets,
Midline, sorry, the left shoulder, upper left shoulder.
he had the blood drained round his lung and underwent immediate neurosurgery. Surgeons cut out a section of his skull to relieve the pressure and remove bullet fragments from his brain. The man spent 2 weeks in intensive care, but incredibly survived. He's now undergoing rehabilitation for a brain injury, but doctors are hopeful of a good recovery.
Certainly a lot of patients who've been shot 3 times to the chest, to the back where the spine is, and also to the head. Most of them won't make it to hospital, so he's been extremely lucky given the injury he's had.
When Dr. Meyer and her team took care of father of 3 Matthew, he'd been using a chainsaw when he fell off a container and broke his back.
Oh, Tar. Good girl.
It's now 3 months since the accident, and Matthew is back home with his partner Rowena and their children.
There you go.
It's hard to put it into words. It was the most painful experience I'd ever had. I vaguely remember before Rowena called the ambulance whether it was the right call. I thought if we could wait 15 minutes, maybe a couple of Panadol, it'd be okay, but it didn't turn out that way.
Matthew had major spine surgery to repair his vertebrae with 2 steel rods, and the construction worker hopes to return to work soon.
6 to 12 months was the time frame I've been given before I'd be able to pick my daughter up, I suppose. Come on. Yeah, they don't understand the reason why you can't pick them up. I think I'm pretty lucky, really. I mean, I could have ended up paralysed, I could have been hit by a chainsaw. I did a front flip and then basically landed fair and square down there on my bum. Container 1, me 0.